The purpose of angioplasty is to open up arteries that supply your heart muscle to improve the blood flow that the heart muscle requires. This is done with balloons and stents being a mesh-like structure or scaffold to keep a heart artery open. The difference between angiography and angioplasty is that angiography is a procedure to simply delineate or look at the heart arteries to see whether there are any narrowings or blockages. The procedure of angioplasty is the use of balloons or stents or other adjunctive therapies to open those arteries and improve the blood flow to the heart muscle. So the seriousness of an angioplasty very much depends on a number of factors, and for any patient going for an angiogram or an angioplasty, they should be discussing the risks and benefits that are pertinent to them and to the operator before they have the procedure done. Risks involved with an angioplasty include bleeding, because it's a procedure done either from an artery in the wrist or in the leg, bruising, a small risk of the heart going into a funny rhythm, and the heart will be monitored the whole way through the procedure. And there is a very small risk of very serious complications, such as a heart attack, such as a stroke, or something more serious, maybe not making it through the procedure. But these risks are very small, and generally angioplasty is very safe when undertaken in proper hands. So it's important if a patient is recommended to have angioplasty that they've explored all the options before going ahead with this procedure, and those include very much maximizing their tablet-based therapy before they have the procedure done. What should you avoid after angioplasty? Partly depends on what route the angioplasty has been done by, whether it's been done through an artery in the leg or through an artery in the wrist. The majority of angioplasty in the UK nowadays is done through the wrist, and we simply tell patients to treat their affected or used wrist as if it's broken for the next 48 hours, and also partly dependent on the circumstances in which the angioplasty has been done. There may be a period of time for which they cannot drive for, but that's usually very brief. So an angioplasty procedure can last anything from 30 to 45 minutes all the way up to 3 hours, depending on the complexity of the disease that needs to be treated.